So, again, in order to fit the diagnostic criteria for ADHD, according to the psychiatrist, a kid has to have 6 or more symptoms lasting 6 months. Well, okay, that's great. So why do you want the diagnosis? Well, the psychiatrists like the diagnosis in order to decide, is it time to start medications? But what if a kid has 3 symptoms that are very impactful for only 4 months? So they just ignore it for 6 months? Well, I guess by their criteria you do. I find that inadequate. I think if a child is having any difficulties with any of these symptoms, we ought to be, and they're impacting them in terms of their learning and ability to function well, then we should be trying to figure out what is the root cause and fix that if we can. So what do I think about diagnoses? I don't really care, actually. I'm more trying to figure out the symptoms and the cause and how they fit together. So I want to know, is it mainly hyperactivity, mainly poor focus, overfocus, or is it information processing? So sometimes we'll tell a child something and they'll act like they're not paying attention, but it takes them 3 or 4 beats to get the information and then to process it and get it back out again. And we need to give them time if that could be going on. I also want to know, what are the associated symptoms? And could the child be hyper in order to pay attention? So if a child has low energy for a variety of reasons that we'll talk about, sometimes they're moving around because they want to stay engaged in what's going on around them. So let's talk about my overall approach to this, which again should be the overall approach of most integrative physicians, which is to supply what's healthy and needed, remove what's causing harm.
As always, consult your physician before trying any of our products. For more information, visit NeuroNeeds.com. We would appreciate it if you would like, share, and subscribe. Thanks for being part of our journey.